$500 million wasted, and your taxes are footing the bill. A bombshell audit reveals New York's Medicaid program has hemorrhaged over $500 million in avoidable costs because state officials failed to transition thousands of seniors to Medicare. But here's where it gets controversial. This financial bleeding continues unchecked despite repeated warnings, raising urgent questions about accountability in public healthcare spending. Let's break this down. Medicaid, a state federal program for low-income residents, and Medicare, a federal program for seniors 65s, are designed to work together. When someone qualifies for both, federal rules require Medicare to become their primary coverage, saving states millions by shifting routine medical costs to Washington's dime. New York's fatal flaw? The health department hasn't reliably enforced this handoff. Imagine this. A 66-year-old Medicaid enrollee needs a hip replacement. If they're properly enrolled in Medicare, the federal program covers 80% of the bill. But if the state never nudges them to switch, Medicaid, funded partly by New York taxpayers, picks up the full tab. Multiply this by 18,000 cases over a decade, and you've got a $485 million fiscal time bomb. But wait, it gets worse. A 2023 audit first exposed this failure, costing $294 million. Fast forward to 2025, and a follow-up report shows another $190 million wasted. State Controller Thomas DiNapoli minced no words. 2 years after our first warning, taxpayers are still paying the price. Here's the twist. The health department defends the overspending as a small fraction of total Medicaid costs. Critics fire back. This isn't just about percentages. With federal Medicaid cuts looming, spurred by Trump-era policies, every dollar counts. New York now faces a brutal choice: pump more state funds into Medicaid or kick vulnerable residents off coverage entirely. And this is the part most people miss. The fallout isn't abstract. Proposed work requirements could strip 1.2 million New Yorkers of Medicaid by 2026, while enrollment errors leave seniors vulnerable to Medicare penalties. It's a perfect storm of bureaucracy and budget cuts. So where's the accountability? Local social services agencies were supposed to identify eligible seniors, but the health department, the ultimate watchdog, dropped the ball. Meanwhile, Republicans argue Medicaid's waste and fraud justify tighter restrictions, while Democrats warn of a healthcare access crisis. Now we turn to you. Is this a case of bureaucratic negligence, an inevitable byproduct of underfunded systems, or something darker? Should states bear more responsibility for enrollment errors, or is Washington's funding model the real villain? Sound off below. P.S. The stakes couldn't be higher as federal support shrinks. New York's Medicaid program is a ticking clock. Will Albany fix its enrollment pipeline before the next $500 million vanishes? Or will taxpayers and patients pay the price for years to come? The debate starts in the comments.